In this project, we will present an evolution of HIV treatments. As you know that HIV is a virus that attacks the body immune system. HIV can be contracted by being in contact with infected blood, semen, or vaginal fluid. If HIV is not treated, it can lead to AIDS. With the now deficient immune system, the body can be prone to getting infection or cancer that rarely occur in healthy people. Our group has chosen to analyze data that has sprung from study of HIV because this is still an ongoing fight. Currently, there are no effective cure for HIV. However, there are many medications that can control HIV and prevent complications. These medications are called antiretroviral therapy. In this project, our group will analyze the effects of current ART on the patient, suggest how the therapy extends the life of the patients, the limitation of ART, and adherence to ART. Let's start with ART history. When HIV was first discovered, infected patients had a life expectancy of just 1 year. AZT was the first drug to treat HIV infection, but this treatment was short-lived. Today, modern practice use ART, which is a combination of at least 3 antiretroviral drugs to maximally suppress the HIV virus and stop the progression of HIV disease. This is also called combination therapy. Using combination therapy means that it takes more longer for resistance to develop. For example, if only 1 or 2 antiretroviral drugs are used, it is easy for virus to develop resistance. For this reason, using just 1 or 2 antiretroviral drugs is not recommended. But if 2 or 3 drugs are used, a successful mutant would have to get around all the drugs at the same time. Now let's move on to the type of technologies to diagnose HIV at early signs. There are 3 main technologies. The first, antibody test. This test looks for HIV antibody in your blood or saliva. This test can only perform after 3 to 12 weeks from getting infected because body immune system takes a few weeks to produce HIV antibody. The second is antigen antibody test. This test looks for both HIV antibody and antigen in the blood. The antigen is the part of the virus that triggered an immune response. If you've been exposed to HIV, antigen will show up in your blood before HIV antibody are made. This test can be performed from 2 to 6 weeks after being infected. The third is nucleic acid test. This test can identify by amount of virus present in the blood. This can detect HIV virus faster compared to other tests, but the cost of this test is very high. Now I will talk about how ART extends the life of the patients.
So how ART extends the life of the patient. As HIV harms your immune system by destroying a type of white blood cells that helps your body fight infection, ART treatment can restore the body immune system. HIV RNA cell count is one of the test response to ART treatment and to monitor the disease progression. So it can suppress the plasma HIV RNA so that the process of the treatment can be monitored and see how the treatment is working on the patient. It can extend the life of patient and help to prevent progression to AIDS. It reduces the transmission from a person to person, for example, from a mom to the unborn child. So the limitation of ART, it includes the drug resistance, adherence, cost, drug-to-drug interaction, and this is the picture shows the common side effect that causes during the early treatment of the ART. So ART resistance. Drug resistance can make the drug less effective, which reduces the treatment option. This happens when because of the long duration of treatment. The graph showed the drug level versus the probability of resistance. As you can see, as the time goes by, the mutation can occur, which affect the treatments. So if we are not able to, so we must be able to suppress the mutation that occurs in order to go back to the normal HIV treatment. So HIV drugs have unique resistant patterns, so it can cause cross-resistance to occur. Nicholas will continue.
Thank you, Aye. Now we will look about the adherence to ART. There have been benefits to adhering to ART, which include improvements of quality of life, such as physical health, ability to have a longer life expectancy, and to suppress and slow the transmission of HIV to other healthy individuals. If a patient chooses to decline or delay treatment, they become to risk of increasing mortality rate, declining mental and physical health, and will put others at risk of HIV if ART treatment is not initiated. The graph to the right shows the increasing averted HIV-related deaths as patients continuously adhere to ART. By 2016, around 50% of the world's HIV-related deaths have been averted just because of ART adherence. Next, we'll continue to talk about qualities of life improvements. So in a study in Southwest Ethiopia, affected persons who had HIV and had ART treatment over the course of 144 weeks responded positively to their physical and mental health after adhering to ART, as shown by this graph. So in the same study, we were able to extract more in-depth details on the qualities of life. So in this table, it depicts more details about various qualities of life, such as satisfaction with sleep, capacity for work, and so on. Overall, there's been a positive improvement because of ART being introduced to their lives. In conclusion, ART research continues to try and improve the lifespan of HIV-infected patients to the general life expectancy number. HIV adherence strategies continue to develop, which helps increase HIV awareness. Some of these strategies that help increase this adherence involves contingency management strategies, patient education, social support, and so on. Hopefully, as more information about this deadly disease arises, this will allow for a cure to develop in the near future.